Health Minister Dr. Zweli Mkhize says his department will continue to investigate the sterilisation of HIV-positive women without their consent. This follows a report by the Commission for Gender Equality that revealed at least 48 women were sterilised. To unpack this, we're joined by Commissioner at the Commission for Gender Equality, Dr. Mofokeng. Dr. Mofokeng, good evening, and thank you so much for your time tonight. Now, of course, the Health Department and the Commission for Gender Equality has taken quite a bit of heat from the 48 victims in this instance of this case and their lawyers, who feel that there simply hasn't been urgency in dealing with their matter.
Good evening, Kathy. And I don't think any one of us can find fault with that assessment. It is noteworthy, of course, that the Commission did take a few years to investigate this in 2 provinces in the country. And also, when we did release the report in February this year, it was literally at the time where COVID-19 pandemic was emerging as a crisis in this country. And so even though the Commission had given the Department of Health 3 months to engage and then provide a progress report to the Commission for Gender Equality, we know that the COVID-19 pandemic, in terms of the Department of Health's activities and what they had capacity for, this issue then again took a back burner. And I think our attempt was to give them 3 months precisely for this reason, to ensure that there's finality and timely resolution and implementation of our recommendations.
There's been a big question around those recommendations and whether or not they've been implemented. I mean, a very basic one, such as the compensation that you felt was due to these individuals, that doesn't seem to have taken place.
So again, Kathy, our recommendations as the CGE are bound by what is within our mandate, and that is the law, right, that prescribes what the Commission can or cannot do. And in terms of our legal investigation, our recommendations are not based on a court proceeding or a criminal case or even a civil claim. This is a right that the complainants, still have. And if they want to pursue that through the court system in terms of getting justice, they still have that right as citizens of this country. What our report was looking for in terms of recommendations was an acknowledgement from the Department of Health that indeed this gross and inhumane, torturous procedures are happening within the public sector. We wanted them to then engage, as per the women's request, a dialogue with them to understand, what the impact of this has been in terms of their psychological and health and well-being generally. The other one was, of course, looking at the issues of filing and record keeping, because in many of the hospitals we visited as the Commission, we found that either files were missing or they were incomplete, and in some instances, no record at all that file and that procedure actually happened, which is why we found this medical negligence. And our report speaks to the ethics of care, not criminality, and it was not based on individual nurses or doctors, but we're looking more on a system issue. And we know that since we launched this report, we've had more women come through to the Commission and laying new complaints. Some are HIV positive, some are not. And this speaks to how much this practice is embedded within public health. And so it's important for us as we go forward for women to know that the Commission remains open and accessible and able to investigate new complaints as we have started the process. And also with this current report, we are getting progress reports from the Department of Health, and they are cooperating as I speak to you now.
Ultimately, this case has to do with a fundamental abuse of people's human rights here, and decisions that are taken on their behalf without even their consent or approval in this instance. If you have more people that join in, and we know that some of these victims are now taking this matter to court, how big a lawsuit do you think that the state could potentially find itself with here?
And this is a good question, right? But it's also like, how long is a piece of string? Because for as long as women have the potential to carry pregnancies and give birth, and of course we know health status in the terms of HIV positivity does give a higher vulnerability, right? Not only of maternal mortality, but also of neonatal death. So when you're thinking about all the international instruments and the treaties that South Africa has signed, we hold ourselves to a higher standard in terms of human rights. And therefore, when you look at then the regional and the domestic laws, such as our constitution, which is explicit on issues of bodily integrity, autonomy, and consent, it really shows you that the problem is much deeper. And although our investigation as a CGE was limited to obstetric violence or reproductive coercion, many other ways, could be argued that, in fact, because of the types of consent forms that are currently being used in the entire system for all of the other medical procedures, they are actually inadequate and don't meet the international standards to prove objectively that informed consent was sought from patients and that the patients then gave informed consent. And so our focus, of course, as the Commission, is very focused on HIV-positive women who are coerced. But I can tell you now, Kathy, even Justice Dikgang Moseneke, in his book, he talks about, the Constitutional Court, and that most of our court cases are around health-related, violations of human rights. So, it's really, it's just so big. But we had to focus, our investigation on the actual complaint, because then those were supported with affidavits, and that's really important.
Dr. Tlaleng Mofokeng, let's leave it there for tonight. She's a commissioner with the Commission for Gender Equality. So it sounds like some progress for those 48 victims, at least the initial 48 who were part of that investigation that was conducted by the Commission.